In this video, you will learn how to run a normal cephalic or vertex delivery without complications like shoulder dystocia. By the end of this video, you should be able to program birthing baby vitals, activate vaginal hemorrhaging, monitor and recognize automatic detection of pulling forces, monitor the evaluation of the birthing baby, and reset the simulator for another labor scenario. Be sure to run through the pre-labor checklist before starting. Make sure the baby has sufficient charge to run a complete labor. Once Victoria is completely prepared for the birth, click the normal delivery category in the Quick Launch page. Select any of the scenarios with a baby icon and click Start Scenario to begin the labor. If you want to run an accelerated delivery, you can use the labor speed slider to speed up the scenario. To program the birthing baby vitals, click the baby icon at the bottom of the submenu on the left. You can click the value of the vital and make changes by clicking the buttons or moving the sliders. The baby runtime determines how long the baby will play the vitals after being delivered. To activate the vaginal bleeding, click the icon of the uterus on the left. Click Vaginal Hemorrhage and click On. When the baby reaches the appropriate descent, if vaginal hemorrhaging is turned on, the simulator will bleed. The bleeding will stop automatically, or you can manually turn it off by clicking the vaginal hemorrhage button and clicking Off. Victoria will automatically detect and log any pulling forces on the head of the birthing baby during the delivery. When the progress bar reaches the end of the labor graph, the birthing baby will unlock from the motor, allowing it to be delivered. Once the birthing baby is delivered, the umbilical cord can be clamped and cut, the placenta can be delivered, and the newborn can be evaluated for signs of neonate health. The neonate can display cyanosis, crying, programmable heart and lung sounds, and realistic head movement. It will play whichever vitals were programmed during the labor for the duration designated by baby runtime. Once the scenario has ended, resetting for the next scenario is easy. Do not attempt to lift the contractions cover without first releasing both latches. To find the release latches, slide a finger up from the post on each side of the abdominal cavity frame. Press the release latch and gently lift the cover enough to disconnect the data cable. Then remove the cover. Remove the birthing rod by pressing the lever on the motor, and remove the birthing ring from the retaining hook. Press the reset button in the software to return the motor to its original starting position. Once the motor has returned to the starting point, use the drain syringe to pull the mineral oil and simulated blood from the drain port. Victoria is now ready to prepare for another birth. Be sure to complete the pre-birth checklists while setting up for another delivery.